Intermittent fasting is currently one of the world's most popular health and fitness trends. And besides assisting with weight loss, intermittent fasting has many additional health benefits. By definition, intermittent fasting is an eating pattern that involves regular short-term fasts or periods of minimal or actually no food consumption. Intermittent fasting is an eating pattern where you cycle between periods of eating and then fasting. Here is the most common way intermittent fasting is performed. First, you start your eating at noon and your last meal at 8 p.m. Easy, right? Well, you are technically fasting for 16 hours every day and restricting your eating to an 8-hour eating window. This is the most popular form of intermittent fasting, and it's known as the 16-8 method. Another equally beneficial method is called the alternate day fasting, or ADF. In the InterFast trial, healthy normal weight adults followed a strict alternate day fasting protocol for 4 weeks. The protocol called for alternating 36 hours of zero-calorie intake with 12 hours of unlimited eating. Zero-calorie fluids were permitted on fasting days. After 4 weeks, subjects showed improvements in cardiovascular risk markers, reduced fat mass, especially in the trunk or the abdomen, and increased levels of ketone B hydroxybutyrate even on non-fasting days. In a separate part of the study, research evaluated 30 people who had already practiced ADF for more than 6 months in order to assess the long-term safety of this type of strategy, and they found reduced levels of inflammatory markers associated with aging, LDL cholesterol, and T3. Whether or not lower LDL cholesterol is beneficial is debatable, but it's well established that lower T3 is associated with increased lifespan in numerous animals and lower order organisms. However, when T3 is lowered because there's a drastic caloric reduction combined with overzealous exercise, crazy exercise, there's a metabolic slowdown and negative physiological, emotional, and physiological effects, so you don't want to overdo anything. Fat loss is common but not guaranteed result of ADF or intermittent fasting. The InterFast study supports the role of fasting in weight loss because during the 4-week intervention, subjects had a mean caloric reduction approximately of 35% and lost an average of 7.7 pounds. Here are 8 evidence-based health benefits of intermittent fasting. Number 1, there is a significant positive impact on insulin levels and human growth hormone levels. While IF has been found to decrease insulin levels, HGH will increase. This all facilitates fat burning, and IF in turn has a positive impact on reversing insulin resistance. Studies indicate that fasting can help boost your HGH levels. One such study found that after a 3-day fast, your HGH levels increase more than 300%. A week later, they go up by a whopping 1,250%. Number 2, IF has been found effective in helping you lose weight, but even more important, in losing visceral fat. Visceral fat is the harmful fat in the abdominal cavity that causes disease. Short-term fasting actually increases your metabolic rate, helping you burn even more calories. Number 3, several studies show that intermittent fasting may enhance the body's resistance to oxidative stress. Number 4, intermittent fasting has been found to be effective in reducing inflammation. Mount Sinai researchers found that fasting reduces inflammation and improves chronic inflammatory diseases without affecting the immune system's response to acute infections. Number 5, intermittent fasting has been found to be beneficial for heart health. Lowering triglycerides and LDL and lowering blood pressure are just a few of the cardiovascular benefits. Number 6, promising evidence from animal studies indicates that intermittent fasting or diets that mimic fasting may help prevent cancer. Number 7, intermittent fasting shows promise in improving brain health. There's a strong evidence that the forms of intermittent fasting can delay the onset and progression of Alzheimer's disease and Parkinson's disease in animal models. Number 8, One of the most exciting applications of intermittent fasting may be its ability to extend lifespan. In one study, researchers zeroed in on how fasting impacts lifespan. About 2,000 people who had undergone a cardiac catheterization procedure were followed for an average of 4.4 years, including 389 routine fasters who had been fasting regularly for at least 5 years. After adjusting for various factors, researchers discovered that routine fasters had a 45% lower mortality rate than non-fasters during the follow-up period. Start thinking about that fasting.